Here's a Puerto Rico medical revalidation style clinical vignette focusing on a pediatric patient with a fractured arm affecting the C5, C6, and C7 nerve roots. Clinical vignette question. A 7-year-old boy falls off his bicycle and lands on his outstretched hand. He immediately complains of severe arm pain and weakness. On examination, he has swelling and deformity of the midshaft humerus, and an X-ray confirms a displaced midshaft humeral fracture. Neurologically, he exhibits weakness in elbow flexion and wrist extension. There is also decreased sensation over the lateral forearm and dorsum of the hand. Which of the following nerves is most likely affected by this injury? A. Radial nerve. B. Musculocutaneous nerve. C. Ulnar nerve. D. Median nerve. Correct answer A. Radial nerve. Explanation. Midshaft humeral fractures are commonly associated with radial nerve injury, as the radial nerve runs along the spiral groove of the humerus. The C5, C6, and C7 nerve roots contribute to the radial nerve, which is responsible for wrist extension, elbow extension, partially, and sensation to the dorsum of the hand. Clinical features of radial nerve injury include wrist drop due to loss of wrist extensors, weakness in elbow extension if the injury is proximal, loss of sensation over the dorsum of the hand and lateral forearm. Why not the other options? Musculocutaneous nerve B affects elbow flexion, biceps brachialis, and sensation to the lateral forearm, but is usually injured in shoulder trauma. Ulnar nerve C affects finger flexion and intrinsic hand muscles, commonly injured in elbow fractures. Median nerve affects thumb opposition and finger flexion, commonly injured in distal humeral fractures or carpal tunnel syndrome. Let me